First of all, when I did my training, if we had to remove a uterus, for instance, we would either do it through an open laparotomy incision, which was quite common, more than 50% of the time, or for other conditions, people with prolapse and other situations, we would often do a vaginal hysterectomy, meaning all the surgery was from below with no abdominal incisions. And while I've been practicing, the field has evolved and moved forward. More and more we're able to provide laparoscopic hysterectomy, total laparoscopic hysterectomy, and now more recently adding the robotic assisted laparoscopic hysterectomy. The biggest advantage to a laparoscopic hysterectomy is that you're performing a hysterectomy that would otherwise be an abdominal. So in other words, there's really not a big advantage over a vaginal hysterectomy, but there's a huge advantage over an abdominal hysterectomy. I mean, a couple of small incisions, low risk of infection, low risk of hernia, much lower risk of complications than if we go ahead and make a big incision. And the biggest one that patients really care about, and I think generally know about before they even come to see me, is that there's a much shorter recovery time. Well, you can imagine if you have a big incision from here to here on your belly or up and down, you basically, you can't do a sit-up for weeks. And so the amount of time that you stay in the hospital is not a huge difference. I mean, an abdominal hysterectomy patient will go home after something like 2 or 3 days, and usually robotic hysterectomy is less than 24 hours. I think the main difference is if you ask them how they feel about 1 or 2 weeks later, that's where you just get this huge difference. I mean, people who've had an abdominal incision are still really in pain every time they try to get out of bed, and with a laparoscopic assisted total hysterectomy, those people are usually doing much better than that on average.